So it's fourth session. I'm here with the 10 MCQs. So today we will try to answer them. We will try to learn them. If you're having anything to say, anything to mention, so I'm available. So you can mention in chat box, in comment box. We can discuss. All these questions that we are discussing here, we can consider them as a model questions, as a sample questions, because these kind of questions we can find in various entrances. So let's begin. First question I added, question is, in Piaget theory, a child who understands that a ball of clay retains the same mass even when flattened has likely mastered. You are having these four options: egocentrism, reversibility, seriation, and centration. So if you know the answer, you can mention your answer in chat box, in comment box. But this question is I will consider this question as easy, because if any individual is aware about Jean Piaget approach, so they will be aware that what kind of development happen in concrete operational stage. So reversibility is the ability to understand that object can be changed and then return to their original state. Like whenever we are playing, our child playing with clay, and if they are changing, if they are making certain shape, so they are aware, and sometimes they are not aware that yes, we can convert this particular shape into the previous one, and then again we can come back to this particular shape. And when they are understanding it, according to this theory, according to Piaget theory, the concept will develop in concrete operational stage. So in concrete operational stage, child will develop the ability to understand reversibility. Before that stage, they cannot understand reversibility. So here you can see the correct answer is B, reversibility. We can say B is the right answer. So yes, Arjun, you are correct. Nikki, yes, well done, you are correct. Yes, Asha, correct. Harsita, yes, you all are correct, right? So reversibility is the right answer. Next, you can see next question that I added. Which of the following best illustrates Vygotsky's concept of the zone of proximal development? In short, we can say JPD, GPD. So, zone of proximal development. Zone of proximal development. Here you can see zone of proximal development. Options are a student solving problems beyond their grade level without help, a student practicing independently, learning new material with guidance from a teacher, and a student repeating tasks they have already mastered. So these are the options. Okay, I'm receiving few responses. So correct answer, yes, Asha, you are right. Roshan, well done. Harshita, yes, correct. Adil, yes, you are also right. Kia, well done, you are correct. So you all are mentioning the right response. Answer is C, learning new materials with guidance from a teacher. If you are aware about zone of proximal development, so we can divide zone of proximal development into two parts. But to understand types of development according to Vygotsky, we have to understand what kind of thought process will be emerge and will be developed in developmental age of a child. So there are three different types of thought process. Like first thought that child have in the beginning, I can't do, I cannot do. That means whenever they are observing any new task, they're having this sense that I cannot do, mujhse nahi hoga, right? Then, after support of a teacher, parents, caretaker, they are developing sense that I can do, but with assistance, but with assistance. And then third, we can say I can do, and they do not think about assistance. They think I can do without any assistance. So this particular thoughts, there are three different kind of thought development in the thoughts. We can say first two will be potential development, potential development, potential development, potential development, and last is actual development. Last is actual development. Why potential development? Why we call them potential development? Because whenever child having this thought, I cannot do, there are potential to develop their thought. Then they will move at I can do, but I need assistance. There are potential. But when any child reaching at yes, I can do now, that is the actual development. So according to the statement that we are having, which of the following best illustrate Vygotsky's concept of zone of proximal development? Correct answer will be C, learning new materials with guidance from a teacher, with guidance from caretaker parents. So C will be the right answer. Next, according to Adler, the birth order most likely to be highly responsible, organized and achievement oriented is. That means we have to answer which birth order is connected to all these characteristics like highly responsible, organized and achievement oriented. You are having these four options: youngest child, middle child, firstborn, only child. According to Adler, which birth order, as you can see, which birth order is associated to all these characteristics: highly responsible, organized and achievement oriented? You are having options: youngest child, middle child, firstborn, only child. Okay, yes, Nikita, you are correct. Adil, yes, well done. Anukriti, yes, correct, right. Roshan, yes, you are right. Before moving with the right answer, I would like to explain what Adler said. So Adler said there are different birth order, and according to the birth order, child developing characteristics like firstborn child, if they are the first child in the family, then second-born child, then youngest child and only child. But one thing you have to keep in mind, whenever we are talking about first order child or firstborn child, second-born child and youngest child, so if there are two child in the family, so firstborn and youngest child. If there will be three child in the family, then firstborn, then secondborn and then youngest child. And it is also possible that there is only one child in the family, so we have to refer only child explanation that is presented by Adler. So Adler said, if there is firstborn child, so we can find few qualities. They will be responsible, they will be organized, they will be leader-like qualities, they are having leader-like qualities. But there is a certain risk associated to firstborn child if, as a parent, we are not taking care of those, taking care of appropriate parenting. Then risk will be of being anxiety, an anxious child. There will be high level of anxiety in that child. Child will develop characteristics like they are controlling, they try to control others. So there will be high level of anxiety in adulthood. They will develop personality like controlling personality, and they feel pressure to succeed. They always having those kind of stress and pressure to succeed what they want to do. So firstborn child having few qualities: they will be responsible, they will be organized, they will be leader-like person, but there will be a risk of being anxious, a risk of being controlling, and they feel pressure to succeed. At the same time, when there will be second-born child, if there is there are two childs, then there will be two childs, then we can use younger child, firstborn and younger. If there are three childs, then firstborn, secondborn and youngest. So when there will be secondborn, there will be qualities like they will be competitive, they will be adaptable, they will be very diplomatic, and the risk will be maybe, right, that is a risk, they will be a kind of person who are facing overshadowed or left out. They are not able to connect themselves to the other individual or in right any friend circle very easily. So these are the risks. When we talk about youngest child, then we can find there will be few qualities. They will be charming, outgoing, and attention seeking. At the same time, there will be risk like they may struggle with independence or being independent or be seen as less responsible. So according to Adler, youngest child look like they are less responsible as well as they are struggling to feel independent, right? And if there is only child in the family, then there will be few qualities like they will be more mature, they will be perfectionist, and they will be confident. But at the same time, there will be risk like they may struggle with peer interaction or they have difficulties to share their emotions to other individuals. So all these are the characteristics, qualities that any child can develop, and there will be these kind of risk. So according to the options that we are having, youngest child, middle child, firstborn, only child. So correct answer will be C. Correct answer will be firstborn. So Adler believed that firstborn often become leader and perfectionist just due to early attention and later responsibility when siblings are born. So we can relate these qualities, highly responsible, organized, and achievement oriented, to firstborn children. Next, you can see which of the following is not a key assumption of chi-square test. You are having these options. Data should be in the form of frequencies. B. Expected cell frequency should be at least 5. C. The variable must be continuous. And D. Observation must be independent. If you remember, in previous live session, we talked about chi-square, and in those particular question, I explained when we can use chi-square and in which situation it is good to use chi-square, it is appropriate to use chi-square. So if you attended that particular session, you will be able to answer this. So hello Rajni. Hridaya, yes, you are right. You answered for the previous question, right? So you was right. So right now, Anushka mentioning response. Okay, Anushka, got your response. Okay, Sanjukta mentioning. Okay, Sanjukta. So these are the options, and correct answer will be C. The variable must be continuous. C is the right answer. Why C is the right answer? As I told you in previous live lecture, we talked about it. वहां हमने डिस्कस किया था कि द chi-square, whenever we are talking about this particular hypothesis testing, chi-square test, we are using chi-square. This is the symbol of chi-square, right? So sometime if you see this particular symbol x square, that means this is the symbol of chi-square. So chi-square we are using for categorical data, not for the continuous data. The simplest thing that we have to understand, जो हमने previous session में भी discuss किया, whenever we are using chi-square test, we use them for categorical data, not for the continuous data. There are so many other techniques that we can use if data is continuous. And question mentioning which of the following is not a key assumption for the chi-square test, and correct answer is this, right? Just because we need to mention not a key assumption. So the variable must be continuous. No, if variable is continuous, then less likely we will use chi-square. Chi-square mostly we use when data is categorical. So this is wrong, right? This is because they are mentioning which of the following is not a key assumption, not a key assumption. So this is not the key assumption. All these options, right, is key assumption. So accordingly, we have to choose C because a statement asking not. That's why C will be the right answer. The variable must be continuous, but not, because we are using chi-square when data is categorical, not continuous. Okay, rigging wala, you are mentioning C. Sanjukta, right, you are mentioning nominal data only. Okay, Nikki mentioning, but sir, I have seen in problems expected frequency is less than 5, then how it is incorrect? Basically, that is not the parameter. What I mean to say, only on the basis of this, that my expected cell frequency is less than 5 and more than 5, on the basis of that, we cannot choose chi-square. We are not choosing chi-square on the basis of this characteristics, because if you are having this particular options, this options clearly mentioning that the variable must be continuous, and we all are aware that if there will be less than 5, more than 5, and if that is continuous, we cannot use them, right? So no matter this is less than 5, more than 5, if this will be present, if continuous data will be present, then we cannot use chi-square. That's why we will choose C. C is the clear indicator that this statement is wrong. We are not using chi-square in this particular situation. I hope you understood it. If you are having any cross question, if you are having any doubt, you can mention in chat box. When should you consider using Mann-Whitney U-test instead of t-test? Option A, when your data is interval and normally distributed. Option B, when your sample size is large. Option C, when data is ordinal or violates normality. And D, when comparing more than two groups. Okay, so you can mention your right answer in comment box. So if you are having all these options, we can say correct answer is C. Correct answer is C. When data is ordinal or violates normality. What I mean, why I'm choosing this? Whenever we are using Mann-Whitney U or we are using Mann-Whitney U, when your data is not normally distributed or is ordinal. So this is the criteria that we are following. So whenever data is not normally distributed or if that is ordinal, in those particular situations, we will use Mann-Whitney U test. Here you can see here when data is ordinal or violate normality. So I'm choosing it because they are mentioning when should you consider using Mann-Whitney U test instead of t-test. So we will use Mann-Whitney U test when they will violate normality and if there is ordinal data. So this particular things you have to keep in mind. That will be very useful for the exam purposes. When you can use Mann-Whitney, so these are the two major characteristics. When data is not normally distributed and when data is ordinal, that's fine, right? If you will keep these 2 points in your head, that will help you immensely in exam. And sometime you can find a question only on the basis of violates normality and ordinal, right? They can ask this kind of questions and you can use this kind of information that we are discussing to answer that question. So yes, Rajni, you are correcting your response, but now you are right. Well done. Roshan, yes, you are right. Sanjukta, yes, you are right. Well done. Moving ahead. Question number 36. The brain region primarily responsible for initiating REM sleep is. Options are thalamus, prefrontal cortex, pons, hypothalamus. If you know the answer, you can mention your answer in comment box, in chat box. Correct answer will be C. Correct answer will be C. Why C? Whenever we are talking about pons, more specifically, there is one specific organ, we call them lateral dorsal tegmental nucleus. Pons, more specifically, lateral dorsal lateral dorsal, right? Pons, but more specifically lateral dorsal tegmental nucleus, tegmental nucleus. So this particular area initiating and regulating REM sleep and muscles atonia, right? So whenever this kind of a statement will be there, which part of the brain and which brain region primarily responsible for initiating REM sleep. So if we are having these options, thalamus, prefrontal cortex, pons and hypothalamus, we can choose pons just because lateral dorsal tegmental nucleus, that is the part of pons that is specifically responsible for REM sleep and muscles atonia. So C will be the right answer. Question number 37. A 23-year-old woman with anorexia nervosa has a BMI. BMI is body mass index of 15.2 kg per meter square. What is the severity level according to DSM-5? So if any individual having 15.2 kg per meter square, this is the BMI. So what will be the severity level? If you are aware about DSM-5 5TR, so you will be aware that there are 4 severity level in anorexia nervosa. We are discussing about anorexia nervosa, that is eating disorder. 4: mild, moderate, severe and extreme. Mild, moderate, severe, extreme. So where that individual will fall? If you want to answer this question, so you have to be, awareness about those severity level. As I told you, mild, moderate, severe and extreme. So mild will be when individual's BMI will be more than equal to 17. Individual's BMI will be more than equal to 17. If this condition will be there, that will be mild anorexia nervosa. Moderate will be in those conditions when BMI will be between 16 to 16.99. BMI will be between 16 to 16.99. Then we can say this is the moderate level of anorexia nervosa. And severe will be between 15 to 15.99. BMI must be between 15 to 15.99. That will be severe. And extreme will be when BMI is less than 15. When BMI is less than 15. So now according to our statement, according to our question, you can see a 23-year-old woman with anorexia nervosa has a BMI of 15.2 kg per meter square. 15.2 kg per meter square fall between this. So we can say severe will be right answer. So on the basis of this data only, if we are aware about this particular data, we can say yes, correct answer will be C, severe. So I'm getting so many responses. If you're having anything else, if you want to know something that is not related to these questions, then also you can mention in chat box. We'll try to discuss on that particular point as well. Question number 38. In bulimia nervosa, what defines an extreme severity level? Again, as we talked in anorexia nervosa, here in bulimia nervosa as well, there are few specific criteria. On the basis of that, we can understand what is the severity level. Here you can see in bulimia nervosa, this is also a kind of eating disorder. This is also a kind of eating disorder. When any individual doesn't have control over eating, and after eating, they are performing compensatory behavior like putting their finger in mouth to vomit, heavy exercise, all these things, compensatory behavior they will perform. So in bulimia nervosa, what defines an extreme severity level? Options A, body mass index is less than 14. Compensatory behavior will be between 8 to 13 times per week. C, compensatory behavior will be greater than equal to 14 times per week, and BMI below 18.5. Again, we have to understand how we are deciding the severity level and what is the point we are having in DSM-5 and 5-TR. We can answer them. So, when we talk about bulimia nervosa, then severity level will be 4, right? Severity level will be 4: mild, moderate, severe, extreme. And we have to answer on the basis of extreme severity level. Here you can see extreme severity level, right? So mild, moderate, severe, and extreme. So when we talk about mild, that will be 1 to 3, between 1 to 3 episodes per week. So if any individual having 1 to 3 episodes, compensatory episode per week, that will be mild. 4 to 7 will be moderate. And when any individual having 8 to 13, now you can see severe. 8 to 13 means at least one episode in a day, and it could be two as well. So 1 or 2 episode per day, but we are evaluating on the basis of week. So 8 to 13 per week, and if more than 13, that will be extreme. So here you can see in bulimia nervosa, what defines an extreme severity level? Extreme, right? So extreme is more than 14, or more than, right? 14 and more than 14 we can say, right? 14, I am just writing 14 and more than 14. So here you can see correct answer will be C, because C mentioning compensatory behavior will be more than equal to 14 times per week. So according to this extreme, we can say C will be the right answer. Okay, now we are moving ahead, and this is second last question that we are discussing. Question is, which of the following condition justify the use of point biserial correlation? Options are: both variables are ordinal, B, one variable is continuous, the other is dichotomous, C, both variables are continuous with more than two label, and D, one variable is nominal with more than two variable. Whenever we talk about point biserial correlation, so point biserial correlation we are using, and this is the thing that we have to keep in mind for exam purposes. We are using point biserial correlation when one variable will be continuous, like test score, and other variable will be dichotomy, like gender, male, female, third gender. Whenever we are answering yes or no, like are you smoking, yes or no, gender, male, female, right? So third gender, like this kind of thing. So if one variable is continuous and if another variable is dichotomy, we can say we can use point biserial. So if you look into all these options, then you can find that B will be the closest one. One variable is continuous, the other is dichotomous. We can say B will be the right answer, right? And Last question you can see. A researcher studying a spinal cord pathway notices that neurons from the raphe magnus nucleus project down the spinal cord and influence pain sensitivity. Question is, what is the role of raphe magnus in pain modulation? And your options are, it enhances pain signals via dopamine. B, it inhibits pain perception via descending serotonergic pathway. Serotonergic pathway means or serotonergic, right? Whenever we are talking about this particular term, serotonergic, whenever we are using serotonergic neuron or serotonergic is associated to serotonin. So whenever we are using serotonergic, that means that is related to serotonin. Serotonergic neuron means those neurons who are containing serotonin. Serotonergic pathway means those pathway that secreting and that influencing serotonin. Option C mentioning it triggers muscles spasms during pain, and D, it detects pain but does not modulate it. Question is, what is the role of the raphe magnus in pain modulation? So how raphe magnus impacting us more specifically in pain modulation, and these are the options. If you are aware about raphe nucleus, so correct answer will be B. Just because raphe magnus, not nucleus, raphe magnus. If you are aware about the raphe magnus, so raphe magnus is responsible for sending descending serotonergic fiber that more specifically inhibiting pain transmission in spinal cord. So whenever any individual having pain, so at that time raphe magnus send serotonergic fiber that specifically inhibit pain transmission in the spinal cord. And we can say this is the key mechanism in our body for central pain modulation. So if in examination, if they're asking which mechanism we are using centrally to modulate the pain, if there will be option like raphe magnus, so we can choose raphe magnus. Raphe magnus is responsible for inhibiting pain transmission specifically in a spinal cord. So correct answer will be B. B is the right answer. B will be the correct answer. So I hope you learned something new in this live session, right? If you're having any doubt, queries after this particular session as well, you can mention in chat box, you can mention in comment box. I know this is the exam time and many individuals doing preparation for M.Phil, for masters, UGC NET में भी बहुत ज़्यादा time रह नहीं गया. We are in April. We are expecting that in June there will be exam of UGC NET JRF. So I hope this few questions that we are discussing weekly that helping you out. If you're having any doubt, any query, if you are watching this video when we are not live, when I am not live, you can mention in comment box, chat box, and I will try to answer them. So that's all for today. Right. Bye. Take care. Bye. Bye everyone.